Hi there, my name is Dr. Angela Kwong and I'm an Australian GP with a special interest in medically supervised weight loss. In today's video, I'm going to be comparing the different needles that are used for subcutaneous injection. So today I've got liraglutide, brand name Saxenda. I've got semaglutide, brand named Ozempic, and I've also got tirzepatide, brand name Mounjaro, which can be drawn up with a needle and syringe that is used for subcutaneous injection. So let's get started. The first one is liraglutide or Saxenda, and this uses the Novofine 32 gauge 6mm long needles. And that's a close-up for you. And the second one is semaglutide or Ozempic, and this one uses the Novofine 32 gauge 4mm long needles, so just a little bit shorter. And I'll just show you a close-up of that needle as well. There you go. Now, Mounjaro or tirzepatide comes in a vial, which means that you need to draw it up using a needle and syringe. And I have got a separate video that will show you how to do that, and I'll drop that below. I'll also show you which needle and syringe that I use for subcutaneous injection. It is the BD Ultrafine that is 6mm long. And I'll show you how long that one is as well, just close up. There you go. And here are the three needles side by side so that you can compare them. There you go. So you can see that they're all really small, fine needles, and that's because they're used for subcutaneous injection. Now, some patients will tell me that they're a bit hesitant or they're a bit scared to do their own injections, and I've got 3 great tips to get you started. So the first thing is to familiarize yourself, and you will feel a lot more confident. I will drop some links below to a few different videos that will help get you started. The next thing is that if you're quite scared to use a needle, I want to reassure you that these needles are really short and really fine. In fact, they're just about as long as a staple. So let me show you my stapler. Here's my tiny little stapler, and if you have a look at a staple, it is also about 6mm long as well. So they're all about the same length, similar to a staple. So if you keep that in mind, that it's really just as short and as fine as a staple, then before you even open up your needle, before you even draw up your medication, then just get out a staple and desensitize your hand or desensitize your belly to it, and just get yourself started by touching your skin to the staple and see how you feel desensitizing yourself to that response. The last thing that you can do is just get an ice pack and numb the area beforehand, before you do your injection. Well, I hope that this helps, and I'll see you in the next video. Bye.